Hello, everybody. Welcome back. Thank you so much for joining in the third and the last video from the routine food care service series that we are doing. In the last video, we have seen what are Q modifiers, how to apply them, and the documentation requirements that are required for the service. And in this video today, we will see the utilization guidelines and the limitations that are associated with the routine food care services. Firstly, this is Ellen Green from Coding Operations, Practolytics. With no further delay, let's begin today's video. Today, we'll start with the limitations that are associated with this service. Limitations. When we talk about limitations, the first thing that you are supposed to remember when the patient's condition is designated by an ICD-10 CM code with an asterisk in your respective state local coverage determination, it indicates that the routine food care service will be reimbursable only if the patient is under active care of a doctor of medicine or osteopathy. It should be either an MD or DO or NPP for the treatment or evaluation of the complicating disease process during the 6-month period prior to the rendition of the routine type of service, or if the patient had come under a physician's or NPP's care shortly after the service were rendered. Second one, the evaluation and management service for any of the conditions defined as routine food care will be considered ineligible for reimbursement, with the exception of the initial evaluation and management service performed to diagnose the patient's conditions. So rest all of the E&Ms stay as non-payable service itself. And then E&M services provided on the same day as routine food care by the same doctor for the same conditions are not eligible for any payment, again with the exception only if it is an initial E&M service to diagnose the patient's condition, or if it is significantly and separately identifiable service, then no problem, you can use it and bill the service utilizing a modifier 25 and documenting it with a proper medical record. Additionally, whirlpool therapy performed prior to the routine food care services exclusively just to soften the nails or skin is not eligible for any separate payment. Now, routine food care services are always subjected to national regulations which provide definitions, indications, and limitations for Medicare payment of routine food care services. Let's see exceptions to routine food care services. These include routine food care that is necessary and non-integral part of otherwise specified or otherwise covered service. Treatment of warts on food. The presence of systemic conditions such as metabolic, neurologic, or peripheral vascular disease. Moving ahead, mycotic nails. In the presence of systemic conditions that we have discussed about or just discussed prior, in the absence of systemic conditions, an ambulatory patient must have marked limitation of ambulation, pain or secondary infection resulting from thickening and dystrophy of infected toe nail plate. A non-ambulatory patient suffers from pain or secondary infection resulting from thickening and dystrophy of infected toe nail plate. Now let's go ahead and see what are the utilization guidelines that are associated. Routine food care services are considered medically necessary once in 60 days. So please make sure that you're billing only within this frequency, and if you exceed this limit, please be prepared that your claim would be denied for medical necessity of the service or just for non-medically required. That's all for the day, and with this video we have closed the routine food care service series and hope this helped you understand the complete concept of the routine food care services And we will be back soon with another series. So please stay tuned to us, and thank you so very much for your unconditional support and valuable time. If you still have any questions, queries, please reach us out and speak to our professionals. Thank you so much for your time.